Quickr is everyone's health guardian. We sit at the intersection and bridge the gap between the primary care provider, the primary care patient, and clinical trial researchers. And what that means is that we give providers one platform that does the work of three and saves them 30% of their time. Howdy, everyone. I'm Ian Cash, CEO and co-founder of Quickr. Now, when I was 13 years old, I was actually paralyzed from the neck down for over 5 years. And I already know what a lot of y'all are thinking. Ian, that must have sucked. But I'm really happy to say that that's not the case. And when I think about it, it's because of my mom. She wasn't just my guardian. She was my health guardian. Scheduling, communicating, requesting and maintaining my healthcare records, and most importantly of all, finding me personalized care. But for the vast majority of Americans, they don't have that. And what's even worse is that I could have potentially have shortened my recovery period by participating in clinical trials, or at least just pushed life sciences further. But neither me nor my mom was ever made aware, and there certainly wasn't any hand-holding or guiding in the process. And that's where Quickr comes into play. Quickr is everyone's health guardian. We sit at the intersection and bridge the gap between the primary care provider, the primary care patient, and clinical trial researchers. And what that means is that we give providers one platform that does the work of three and saves them 30% of their time. We give patients an amazing patient experience so that they're not just engaged, they're also actively participating in their own health. And that gives us the opportunity to give them more personalized and accessible care. And what's really huge here, where the massive value is in our ability to leverage the provider and the patient relationship and make clinical trial recruitment much easier. And most importantly, make sure that they are engaged throughout the process and actually see the entire trial through. We launched just this last August. We've already signed 12 independent clinics, bringing us to 10,000 patients. And if that wasn't enough, we just signed an additional 8 clinics last week as part of a network. We're now stepping out for our $2 million pre-seed round. And this is really so that we can keep up with the massive demand that we're seeing and make sure that we develop the product and get ourselves to 150 clinics within the next 18 to 24 months. I'd love to provide any clarity, really pick into your brain and answer any questions that you have for me so that we can figure out how we can work together.
Awesome, Ian. If anyone does have questions, you know where to put it, down in the Q&A. Ian, you have been growing quickly, signing new contracts, evolving where necessary, and as a young company moving quickly. I just want to know, what's one thing that you've learned about the market that you didn't know before, and maybe a way that you adjusted your approach based off of what you learned?
Yeah, absolutely. I mean, the very first thing, and I think this is an appropriate slide for it, is that the way that we're tackling primary care and the way that we've really found our beachhead market. So it's not primary care as a whole, which is where we started, and we will eventually get there. The niche that we're starting in is direct primary care. So these are the guys that, are subscription-based. They're all value-based. They're not just helping you with chronic disease management. They're working on prevention, and they have an amazing relationship between the patient and the provider already. The biggest problem that they're facing, though, is they have a health tech that looks like this. And if you look behind me, you can see that she had to buy a TV just so that she could have all the programs up. And she found by auditing her time that she is actually wasting 30% of her time every single day. So we stepped into there, and we've just really focused on delighting the direct primary care, which is growing at an outrageous rate and really is the future of primary care.
I recall this from a previous conversation we had. Can you speak to how that relationship with the head of a direct primary care clinic, how that speeds up the sales cycle? Because one of the challenges in this market are long hospital sales cycles.
Yeah, absolutely. So one of the biggest things here, and I think it's on this side, but trust is the biggest piece here. With DPCs, they're the owner of their clinic, right? These are the independent clinics. We're not going after hospitals right now. And so the sales cycle is very slow, or very low, or short. We were actually impressed. We had predicted 3 months on a sales cycle. We've been getting clinics to sign up on the first call. And now they are saying, word of mouth is going out and they're coming to us and asking, how can we sign up? So we've been what turns out to be very conservative in our prediction of what that sales cycle would be. It's been nearly immediate.
That's awesome. We got a question from the chat. Where and how do you access and catalog and keep up to date with clinical trials?
Yeah, absolutely. So what we're doing is we're partnering, and I wish I had a better slide for this. What we're doing is we're partnering with CROs to make sure that this happens. So we are not only keeping track of everything, within our system and encouraging the engagement between the provider and the patient. We're partnering with CROs that are activating that primary care center as a site so that they can gather the information they're already gathering and just send it along through us. I hope that answers the question. If not, I'm happy to dive in personally with them later.
Yeah. Talk to us a little bit more about the competitive set, folks trying to come in and create a better EHR for direct primary care specifically.
Absolutely. I mean, what you're going to see is that everyone is still just building for the payer. And that's great. And we want to make sure that the payer is happy, but they're not focused on the provider. They're not focused on that patient relationship. And they're not really focused on the UI UX design aspect of it. One of the things that we've seen, and there's a great quote right here, maybe a little small, is that the design that we've built, it's like a door that needs to be opened. When we get in front of a DPC, they see our design, they see how we're thinking through it. And it's not, we've had another quote, it's not a brain that doesn't know how to function. It's very straightforward. The workflow is immediate and straight through. And so that's really one of the secret sauces here on how we're able to adopt them so quickly and make sure that nobody else is stepping into here. They know that we're designing for them. We're designing alongside them. We're constantly talking to them every single week, making sure that we have a really, really strong relationship, and other people that are building or currently in their health stack, they can't even get into contact with. They hit support, they try to talk to them. They may hear back in a month or so. And it'll just be by text. And we just hop on the phone. We make sure that we are absolutely focused on delighting them at every step of the way.
Ian, how did you think about building a team that could address this challenge? Can you talk a little bit more about the experience on the team?
Yeah, you bet. Piece by piece, we've got the 4 core members at the top. None of us have a medical background, and we're actually kind of proud of that. We like, leveraging our young age and the fact that we're thinking about things fresh. We have filled all of the medical places with advisors. So whether it comes to clinical trials, it comes to DPC, it comes to EMRs, we've filled those gaps. As far as the team is concerned, I mean, we've been able to build everything with just the 4 of us. I'm engineer number 2, working alongside Alex Hansen, who was so sought after. He actually turned down an $800,000 salary at Amazon so that he could come work for us because he believes in what we're doing and he wants to build it right. Adam Bragg has come in and not only bolstered our sales pipeline like absolute mad, but he's been the one that's been working the design and talking to the customer every single day. And Juan is really the absolute glue that keeps us together, because I think, if you have a young team, we want to go out, we want to do everything. Juan keeps us focused and moving forward in the right direction.
Awesome. And one more question. We'll try to make it somewhat quick here, but from the chat, how are you thinking of scalability if this platform is so customer centric, that high touch sense?
I hope I understand the question properly. As far as like how we're scaling into multiple clinics and making sure that it's all very smooth experience, it is one universal experience. So they're able to come in and templatize, as a provider, I can templatize the notes that I'm doing, whatever that may be. But ultimately, we always have your calendar here. We always have your chat. You can set up the type of calendar events that can come in. We have the right notes and everything that are set up for you. And then for the patient, it's again a universal experience. It's really easy to get into. It's all chat based, so we don't have to build anything crazy or drop in a bunch of wild features that people don't understand. They come in and they say, I want to schedule something. It will pop up and it will say, okay, what kind of event do you want? And then you just have the little buttons that will go in and it will change it into a conversation. I hope I understood the question.
I think the heart of the question was, you mentioned a second ago that if someone picks up the phone, they get your team and they get answers quick. And so as you scale, how are you going to keep that sort of high touch, customer centric concept?
Yeah, I mean, it's at the core of what we do. So we are focused not just building, sales development reps, but really customer success managers here. where our operations team is going to be what we're growing versus the engineering team, because the engineering team is really just, we know what we're building at this point. The operations team needs to scale with these clinics and make sure that they can always be talked to and feel seen and heard.